How do population studies influence healthcare resource allocation? In recent news, population studies are making headlines as they significantly impact healthcare resource allocation in the United States. With ongoing discussions about healthcare access and equity, understanding how demographic data shapes these decisions is more important than ever. Many people are curious about how their local healthcare services are funded and distributed. Population studies provide essential information about the size, age, race, and health conditions of various groups. This data helps policymakers and healthcare providers determine where resources are most needed. For instance, areas with a higher proportion of elderly residents often requiring more chronic disease management and long-term care services. Additionally, demographic data can reveal communities with higher rates of specific health conditions. This information signals a need for targeted interventions or increased medical supplies in those regions. For example, if a community has a higher prevalence of diabetes, healthcare providers can allocate more resources to diabetes management programs. Population studies also highlight disparities in healthcare access and outcomes. Recognizing these disparities allows for adjustments in resource allocation to reduce inequities. This might mean increasing funding for underserved areas or expanding programs that address specific health risks prevalent in certain populations. Moreover, population data supports planning for future healthcare demands by projecting trends like population growth and migration patterns. This proactive approach ensures that healthcare infrastructure, workforce, and supplies keep pace with changing needs. It helps avoid shortages and inefficiencies that can arise from sudden demographic shifts. In the past few weeks, we have seen increased discussions around healthcare funding and its impact on communities. Policymakers are now more focused on using demographic data to inform their decisions. This approach makes resource allocation more precise and responsive to the actual needs of the population. Overall, population studies are essential for guiding healthcare resource allocation. They inform decisions about where to direct funding, how to design health programs, and how to prepare for shifts in healthcare demand. As discussions about healthcare equity continue, understanding the role of demographic data will remain as a hot topic.